Good morning, good afternoon, and good evening. Welcome to our social media live today. We have with us our guest, the Chief Scientist of WHO, Jeremy Farrar. Welcome, Jeremy.
Thank
to
you.
The show. Through our lives, of course, we connect to a lot of audiences across our channels. If you have questions, let's say on X, please tweet to us with the hashtag AskWHO and we'll take your questions. And on other platforms, leave your questions in the comment box, such as Facebook, YouTube, and LinkedIn. With that disclaimer, let's begin. Welcome, Jeremy, to the show.
Thank you very much.
So my first question is to our audiences today. How would you describe your role at the WHO as a chief scientist? What does a chief scientist do?
I haven't worked it out yet, but I'm 3 months into it, so I still feel very new, and pay tribute to my predecessor, Samir, who was in the role for, I think, 4 or so years. And of course, it's changed a bit, because during her time here, most of it was dominated by COVID and the pandemic. And of course, now we're out of the public health emergency, even if the COVID has not gone away. And so we're redefining the role in a bit. But yeah, as Tedros said recently, WHO has to be a science-centered organisation. I mean, science and evidence is at the heart of what it's done for 75 years. And I see my role as supporting the scientific community within the organisation, at the country level, at regional level, and here in Geneva, to facilitate their work, rather than doing my own science myself. So I think, obviously, it's a huge privilege to be here, and after a career that I've had, it'll be the crowning moment of my career. But if we can make science at the heart of everything WHO does, if we can make science lived in countries, trusted by communities, dealing with the uncertainty of science, then I think we'll have made our contribution.
So what is your, if I may ask, your vision around science and research at the WHO?
Well, I think WHO does do science. There's a lot of scientists across the whole organisation, but it also does an absolutely critical role in facilitating science, in making the case for science. And whenever I use the word science, I mean everything from social sciences, biomedical, public health science, data science, AI and computer science. I mean, I think the modern public health science is much broader than it was when I started my career, and that's a very good thing. It also, though, has a critical role in encouraging countries to invest in science, to invest in the scientific enterprise, in their universities, their institutions, their companies, and also to make sure that science is part of the policy-making framework. Policy needs to be somewhat separated from science, but policy is better when it's informed by science. And I think there is a danger that the political systems and the diplomatic systems and science diverge. People speak different languages, they speak different cultures, and I think part of our job is to try and make sure these are together and aligned, and then the scientists know their role, and the policymakers can use the science to make the best informed policy decisions.
So you speak about evidence informing policy-making decisions. Now, what role do scientists have to make that happen? My
one plea to scientists around the world is engage in this process. I'm not reflecting on any individuals, but you can't criticise the political and policy arena if you don't then engage with it. And I think it's fantastic when scientists, obviously I'm using my own example here, but scientists maybe do their science, but engage in the policy arena, give their own advice and guidance, knowing that in the end it's going to be policymakers that make their choice. But it's critical to engage in that process, I think, and not just engage in it in a crisis, but engage in it all the time. Make the case for science, make the case for trust in science, make the case to people from a political and policy arena who may not come from a scientific background themselves, but have those conversations so that we bridge this gap of people who either say I'm a scientist or I'm not.
You also spoke about AI and the intersections between science and healthcare and artificial intelligence. Where do you see that going?
I think we're on the threshold. A revolution may be too strong a word, but like all huge technological advances, even in my professional career, I think the area of data science, computer science, and including artificial intelligence and all that comes with that is going to transform the way people access healthcare, the way they see preventative strategies, treatments, vaccines, etc., the way they hold their data. I think it could be incredibly empowering. But also it liberates, I think it can liberate healthcare professionals from doing the things that only humans can do, which gets us back to the empathy of nursing and medical practice and other disciplines, and away from things that can be better done actually through computers. So I think we are on the cusp of a revolution, and what's critical is that the scientific community, the WHO, the healthcare workforce around the world are part of this debate about how we can use AI and data in the best way to gain the best possible benefit for the maximum number of people. But we'd also make sure that we protect people's rights, that we protect their privacy, and we protect their ownership of their health. And if we can get that balance right, then I think it will be hugely positive.
But there's also this conversation about equity and technology access. Now, there's a lot of cynicism of whether this kind of technology in healthcare is going to be available to all, and whether some parts of the population, specifically the vulnerable populations, will be left out. Now, how do we address this bottleneck, if you think it's a bottleneck, or what could be the solutions?
Yeah, I think this is one of the key lessons of the last 3 years, but in essence, although it may have become people's attention in the last 3 years, the inequity within countries and between countries has been growing again through my career. And when we're on the threshold of the change that we are under with the data science, computer science, artificial intelligence, and everything that goes with it, this is an opportunity for countries around the world, and indeed WHO and the other United Nations technical agency, to say we haven't really totally entered this era yet. But let's, before we do, make sure that we put equity and access at the heart of it, rather than in a decade's time saying, hold on, why didn't we build in the diversity, the inclusion, and the equity that goes with this technological advance? So let's learn the lessons of the last 2 or 3 years of the inequitable access to interventions like vaccines and others, and say, on the threshold of this revolution in technology, let's build equity and access and the rights of people into that from the start, rather than trying to tack it on afterwards as an afterthought. Can we do that? I think we have to do that. Otherwise, you're right, we will be increasing the inequity globally, which is already severe.
You did talk about inequity and how that we saw that in very many ways during the emergency phase of the COVID-19 pandemic. What have been some of the core lessons that you can think back when the world went through this really scary period of the pandemic? And what do we need to take into building resilient and future health systems? Where do we stand now?
Yeah, I think there are lessons on this pandemic, but actually, in truth, there are many lessons to learn from a series of epidemics and pandemics the last 25 years. And one of the lessons to me is we shouldn't see these as discrete episodes, one-offs that aren't related. There is a trend happening over the last 25 years, and in some way different ways of my own. I've been involved in many of them, going actually back to a Nipah outbreak in Malaysia in 1998, 1999. And that is that there are some underpinning drivers in the 21st century: climate change, biodiversity loss, human-animal interactions, urbanization, trade and travel, which are the drivers of whether we're seeing SARS-CoV-2, MERS in the Middle East, Nipah in Malaysia, the pandemic of 2009. So I think we need to see these as dreadful outcomes of wider things that are happening in society around the world, and we have to address those underpinning drivers. And the other key lesson for me from the pandemic in particular was what you have before a pandemic hits will be hugely important in how you address it. If you have inequity in your health systems, if you have a very strong scientific base, if you have good scientific evidence coming into policy making, if you have a fragmented system that is not used to working together, if you have no manufacturing capacity or no scientific base, then you will struggle when a crisis hits. And a crisis happens so quickly. You know, go back to December and January of 2020 and think how quickly that evolved.
Correct.
If you're trying to establish professional social networks, if you're trying to address inequality, if you're trying to produce a vaccine and then manufacture it and distribute it, you'll fall behind the speed of the pandemic. And once you fall behind an exponentially growing pandemic, you're always playing catch up. Yeah. So to me, the crucial element is the word you used, which is to build resilient health systems and scientific systems before a crisis hits, and then use them all the time so they're useful and trusted by communities before a crisis hits. And that will, I think, put you in better stead when the inevitable crises occur.
So now countries are negotiating a pandemic accord. It is all about, in many ways, to talk about pandemic preparedness. So do you think this would be a game changer in the way we see, you know, public health? Will this, what would be the benefits, let's say, for our audience to understand a little bit about that?
I do. I mean, and I've sat in on, been part of some of the discussions around the pandemic accord, and nobody should underestimate the complexity of it. With all of the inequality and the scars that came out of COVID, and actually on the back of many years of inequitable access. Yeah. The scars are very deep, and at the moment, I think it's fair to say those discussions are very complicated, and I pay tribute to the diplomats involved because I think they've got a tough job. But if we don't come together as a world after COVID, when every single country was affected one way or another, and say, this may be a pandemic era we're going through, we are going to face more crises like this, and the world has got to come together and to find a more practical, equitable solution to these challenges, then I don't think we'll ever do it. You know, crises are terrible, but they're also a moment of reality check to say, surely, never again. Yeah. And a crisis is one of those few moments when you can actually address some fundamental underpinnings. So I give enormous credit and tribute to the diplomats involved. I couldn't do that job. But I also wish them the best, because if we don't come out of this with some agreement across countries at a time when all the great challenges we face are transnational, in fact, then we'll have missed the opportunity.
So now we are kind of seeing the surge of EG.5, and it's a variant of interest. What does this really mean, if you were to simplify it? Should the world panic? I don't think so, but well, let's hear from you. What are your thoughts about the EG.5 variant?
Yeah, there are many other experts better than me on this. But in my simple language, at least, variants of interest, variants of monitoring, variants of interest, and variants of concern. Variants of interest mean that reports from around the world, in many countries are still monitoring, even though not enough. Yes. That you're seeing a new variant come up, which seems to have a growth advantage. It's expanding in a population, and it may have features which the basic science and virology community are telling us might be important, and therefore this variant, amongst thousands of variants that are circulating in the world, is something that we need to keep a more careful watch on. It doesn't yet reach the stage of a variant of concern, which would be more worrying. But it's to say that we need to keep a more careful watch on this. And this variant is expanding in North America, in Asia, in Europe, and in Africa. So I think it is critical. And one plea would be, as appreciate countries are reducing the amount of surveillance going on. That's perhaps understandable. But some degree of continued surveillance is critical. Otherwise, we don't know where we're going with the possibility of new variants.
You also spoke briefly about the intersections between health and climate. And of course, your social media feeds feature a lot of beautiful images of nature. So where do you see, how profound will be the impact of climate change on health? And what do we need to do now to mitigate this crisis?
Yeah, I hope the images of nature are not... I do live in a privilege to live in a beautiful environment. There are many threats to human health and animal health.
Yeah.
But if I was to pick out two that I think we need to pay more attention to, one would be the all-pervasive and already today, not in the future, already today impact on health, and that's the climate. And I'll come back to that. And the second one, which I don't think gets perhaps sufficient attention, are the very powerful demographic shifts that are going on around the world. Aging populations, public health has done a great job. We are hopefully living longer, but we will live with more multi-conditions, diabetes plus heart disease plus malaria, multi-morbidity. And I think our health systems will have to adapt to that, let alone this changing ratio of people in work compared to people that have now retired, senior people. And these demographic shifts are not just happening in North America, Europe, they're happening everywhere as birth rates fall and the population ages. So I think the demographic shifts is another area that we are not paying sufficient attention to. But climate is often portrayed as something that will happen when we hit 1.5 or 2 degrees in years or decades to come. In my view, at least, the truth is this is impacting us today. Whether it be where mosquitoes fly and therefore where malaria or dengue or yellow fever is present, or it's in extreme heat and the people that run into kidney problems or heart problems or problems with not being able to work because of extreme heat. Pollution. Yeah. It's clear that pollution in our big cities is driving issues on our hearts, on our brains, on the development of young children and their educational opportunities. So climate is not something that will happen to my children or my grandchildren. The impact on health is today. And I think we, and I think WHO is now leading on this, are saying that climate is a health issue.
Yeah, absolutely.
Not in decades to come, but now. And if we don't address it now, we are going to go past a tipping point where it becomes impossible.
Yeah, I mean, we do say climate crisis is indeed a health crisis. We have a question from our audience, Joseph Magero. He's asking a very specific question relating to electronic cigarettes. What scientific evidence has informed WHO's stance on electronic cigarettes?
Yeah, this is a really vexed issue, I think, and many countries around the world are taking very different approaches, from outright banning it, to regulating it, to make it available for people that want to stop to stop other smoking, and also to protect children from starting, or young adults starting to vape and not smoke. And so we're in danger here of creating... The truth is, the only safe way is to neither smoke nor vape. And to make sure that we don't particularly allow marketing to young people to get them into vaping at a young age when they wouldn't have got into smoking. Smoking rates in many parts of the world over the last few decades have come down remarkably. What we shouldn't do is now replace a tobacco smoking agenda with a vaping agenda, and have a whole young community that are now on vaping. So I think the WHO's position on this, that the ultimate is no smoking and no vaping, is the right one. Now, different countries are taking different approaches. I know some countries that are banning, some countries that are regulating, some countries that are using rules and regulations around advertising. I think this is an opportunity again for the world to come together and say, what is the best way of ensuring the best outcome for the maximum number of people? And my advice to everybody would be, don't smoke and don't vape.
Correct. That is indeed very important, and WHO's stance is absolutely irrefutable in that area. We also have a question from one of our audience from Sri Lanka, Vithursha. I hope I'm pronouncing your name correctly. Will AI replace healthcare professionals in the future? If so, what is the impact of AI on patients' feelings and emotions?
No, AI should not and will not, in my view, replace healthcare workers. What I hope it does is it actually frees up healthcare workers to do what only healthcare workers can do, and that is to put, if you like, I speak as a scientist, but put some of the what you described, the emotion and the art, if you like, the humanity, not back into healthcare workers, because I think great healthcare workers around the world have never lost that. But AI gives us the opportunity to use the technology to do what it can do, and use humans to do what we are uniquely placed to do and can only do. And if that means we as healthcare professionals are more empathetic, more understanding, have more time for people, that's a good thing. And if it can also actually improve decision making or feed into decision making of healthcare professionals, improve logistics, improve supply chains, that's a very positive thing. But if I was young, I would still go into a healthcare profession, because I think you're always going to be needed. And I think actually the role in the future may be even better than it has been during my career.
Correct. We also want to talk a little bit about, how we continue to, how do we continue to build trust in science? Because there's so much disinformation online. What could we possibly do as institutions and individuals to combat harmful or bad information?
Yeah, this is, again, I think one of the lessons from the COVID pandemic. I have to say on this, I am a little bit more optimistic than some have been. If you'd said to me 4 years ago that there would be a pandemic and we would generate through great science vaccines, and that too slowly, but over a period of time, those vaccines would be available, and probably 6.5 billion people or 7 billion people have received those vaccines around the world, I would have been amazed. There is a huge issue of what colleagues here call the infodemic, and I think that does need to be addressed. But I wouldn't underestimate, if you look at any of the trust indexes of the last few years, how highly regarded scientists and clinicians and healthcare workers generally are around the world. In fact, the reputation of WHO has gone up during the pandemic. That's a huge tribute to people working here before my time. Again, I think, though, it goes back to what we were saying earlier about you don't build trust in a crisis.
Correct.
You build trust every Monday, every Tuesday, every January, every September, every December. And the more we can do as scientists, as healthcare professionals, everybody involved, to make the case with our families, our friends, in newspapers, in the media like this, talking about issues and being willing to be challenged. Scientists can't live in an ivory tower and pretend that if they just say something, it'll be accepted. It has to be done all the time, and engaged with our education systems and our media, so that we build that trust all the time. And don't think you can build trust in a crisis. Correct.
And what, according to you, is in the domain of public health an area that is acutely underappreciated? You speak a lot about, like how scientists cannot assume that they'll have trust from day one. But there's also like a lot of areas of public health where it's not getting the attention it merits. Do you think there are any areas which needs like laser-focused attention from the scientific community or in general?
I think the whole public health needs attention, and I think public health is about the whole enterprise. It is about doing all of the basics well, and being available to people. So I think it is about the collective. I do agree with you. There are some areas, and I go back over my own career, which I think have made incredible progress. I think cardiovascular disease, not perfect, but I think it's made, compared to when I started, a huge progress. The management of HIV, again, still problems of inequitable access in some parts of the world, but nevertheless, when I started in my first clinical job in London, it was tragic. People, mostly young, were coming in and we could do nothing for them. And now we have therapies that can give people a very healthy and long life. That's been a remarkable progress. I think the areas I would pick that I think we could do with encouraging and further investing in, climate. I'll come back to climate. I think demographics and the changing nature of health and ill health, and the period of time we will all live, hopefully longer, but we want to live in a healthy state, not just living. I would pick out preparing for pandemics. It's difficult to persuade governments to prepare for things when they say it may never happen. I think antimicrobial drug resistance threatens the whole of modern medicine.
Yeah.
Surgery, childbirth, diabetes, and so antimicrobial resistance, I think, is a huge issue. And the last one I would pick out probably is around mental health and well-being. I think that mental health and well-being has such a corrosive impact on everybody, senior people, but also young people.
Yeah.
And the increase in mental health issues amongst the young and senior individuals is really troubling, I think. And unless we address this, opportunities in youth will disappear, educational opportunities will disappear, and I think that is an area that I would pick out.
So we do have questions from the audience exactly on the mental health aspect and how we need to take better care of our mental health. And this is from Shitu Zainab on LinkedIn. She, of course, starts with commending WHO for the advancement in health technology and control of communicable diseases that has helped to improve our life expectancy. But my concern is, she says, we now have people living longer but with chronic conditions, posing more strain on the health sector. How will WHO work to manage that?
Yeah, it's a question that I think we sort of addressed earlier. We should firstly celebrate that life expectancy in many, many parts of the world until very recently was increasing. We were living longer, and that is to be celebrated, and is the success of public health measures. And again, public health means it also stretches into how we reduce air pollution, how we design our cities, how we provide health. It's not just the health arena that can improve public health measures. But as we are aging, we will have, as you rightly say, chronic conditions, and often not just one, but a collection, from diabetes to heart disease to issues of the brain and multi-morbidity. And I think it's that sort of future that we need to prepare for. And we need to give the public health system, but also individuals, families, communities, the information they need to make their choices about their own health. And I do think we need to do more on the promotion of good practices. You know, we know a lot of the risk factors for heart disease, for kidney disease, for brain disease. And if we were all to reduce our smoking, to reduce alcohol intake, we took more exercise, there are a small number of things which, if we were able to do, we would improve people's not just life expectancy, but the years they have of healthy living. And I think this whole area around promoting healthy living, protecting people from the excesses of the commercial determinants of health, and also addressing the social determinants of health, then I think we would live longer and healthier. And that's surely what we would hope for, he says, as somebody of a certain age.
And also on mental health, there's a specific question on equity, like what can WHO do to support mental health services in countries that have underdeveloped systems of care?
Yeah, the mental health provision, I'd actually say that in almost every country, certainly every country I've worked in or been linked with, actually mental health services are sometimes the poor relation of the public health and the clinical system. And I do think there's opportunities here as well in using digital technology, of course, the cognitive behavioral therapy that you can access whenever you need it, not just when a clinic is open a month from now, but actually when you might need it in the middle of the night, often given by peers rather than than people in white coats. I think there is opportunity to democratise and make much more available mental health services. But we also have to invest actually in the science of understanding mental health, in bringing psychiatry, neurology, neurophysiology, psychology, sociology, all of these ologies. We do need to bring them together to say, actually, your combined expertise would be really powerful if we work together to address the challenges of mental health in young people, in senior people, the same. So I think we need a sort of new approach to mental health which tries to bring everyone together and says we're all working to a common issue, whether I'm working in basic neuroscience or I'm working in very severe mental health issues within a clinical setting. And I hope we can bring communities together and gain the collective expertise of all of them working together.
There's also a question about, the pandemic drove a big debate about airborne transmission, and WHO is leading consultations on this issue. Jeremy, could you tell us how they are going?
Yeah, they've been difficult. This is something I've started working on in my 3 months here, and actually the consultation exercise has been going on for quite a long time. It is due for completion. I hope we will bring all of the comments back together again during September, October of this year, so that we can make a final conclusion, which I think will be a consensus of everybody. There's lots of communities involved here, from the public health community, clinical community, the infection control community, how you design buildings, how you design your public transport system. We have then disease-specific issues, tuberculosis, measles, Ebola, COVID, influenza. So, as you can imagine, those communities have worked together, but they've often worked in a little bit silos. And what has been tried to do before I joined, and now I'm trying to overseeing this, is to bring all those communities together and say, can we agree on some common frameworks that will then need detail below them? How do I then apply this to my transport system, my schooling system? How do I use this if I'm looking after patients with tuberculosis or people with unknown respiratory illnesses? I think we have, and I give tribute here to the experts that have come together, hundreds of them, I think we are now very close to a consensus on how that might be defined. And I hope that will be available to everybody in September, October of this year, I hope.
All right. So with that, I think we've had a pretty, we've covered various topics. Is there any final messages for our audiences in terms of the future of science and where WHO is heading?
Well, I've always been an optimist, and I think at the moment the world is facing some huge issues. War on multiple continents, inflation, youth unemployment, debt crises, inequality. There are huge, huge issues. But also it's a time when science is, I think this is a golden era of science. Look what happened, 20 years of investment in mRNA and incredible vaccines available within 12 months. As just one example. We will, I believe, soon, I think, eradicate polio. To go on the back of eradicating of smallpox many years ago. We are in a phase of incredible scientific advance, and therefore I think we need to understand the problems we've got, but also think to the future and say, how can we address these, not by describing the problems, but providing tangible solutions that make a difference to people's lives, and not a difference just to people's lives of my work based in Geneva, but to people in countries and at the subnational level in all countries, so that health and well-being is part of every government's primary mandate. That's where I think we need to get to.
Indeed, and that would get us quicker to achieving health for all, for everybody. With that, I'm just going to wrap up with the names of the countries. A couple of our audiences joined us from a number of countries: USA, Nepal, Ethiopia, Saudi Arabia, Kenya, Cote d'Ivoire, Rwanda, Cuba, Nigeria, Namibia, Tanzania, Bangladesh. I could go on and on. There's a huge list. Thank you so much for tuning in, and thank you, Jeremy, for your time. Thank you. Goodbye until next time. See you.
Thank you.